Myself, Dr. Abhishek Chachan. I'm a senior consultant orthopedic surgeon in Monilek Hospital Research Center. I do joint replacement, complex trauma surgery, sports injury, and spinal surgeries. So today I'm going to talk about ill effect on musculoskeletal system on employment efficacy. Means how it affects burden on this social, what do you say, on employees' health. Because some of the disorders like first let me tell you about the musculoskeletal disorder. Musculoskeletal disorders is an injury or disorder to muscle, nerve, tendon, joint, cartilage, or spinal disc. And this is not acute or fresh injury. It's rather a chronic disease which develops over the time. When worker work in a factory, he maybe have repetitive injury. Like if he's having, like you can say carpal tunnel syndrome. You may have not heard about this. Carpal tunnel syndrome is a condition of wrist where your nerve, median nerve, which supplies your some worker, they are getting repetitive injury due to their work, like wrist injury, repetitive stress to wrist, repetitive stress to elbow and their back. So this will lead to musculoskeletal disorder like carpal tunnel syndrome, chronic low back ache, prolapse intervertebral disc. So this will cause a decreased work efficiency for that worker. So there will be a burden on the factory owner. So they are getting more leaves from their work, and in the end, the early retirement is the main issue. So what, like carpal tunnel syndrome? Carpal tunnel syndrome means it's a condition of wrist where medial nerve, which supplies to the outer side of hand, like your thumb, index finger, and middle finger, and the respective palmar area. So when medial nerve get compressed because of the repetitive injury while doing work in factory or like some other where hand occupation is some other occupation where hand involvement is more. So if medial nerve is compressed, he'll get more and more pain. So this is actually burden on their work. So later on, he will work less. If you go to statistically in US, it's, now is more than $12.6 billion loss due to this occupational deficiency because of the worker. And most of the in US, if you see US, they are having insurance of the worker. So later on, anyhow, insurance will be there, but the burden will be on the society only when a person working life is less. In India, like in developing country, we don't have that facility of insurance. So anyhow, they will terminate from their work, and anyhow, this will affect society also and the workers' family also. So we have to catch this musculoskeletal at the early stage. Like high income country observe this musculoskeletal condition to be one of the major causes of work loss, early retirement, and extra financial burdens on the country. Slowly is developing in the slowly is emerging in the developing country also. It's a substantial loss on the livelihood also. So good musculoskeletal health is essential for the maintaining of active, productive, and prolonged employment efficiency. So with an increase of global retirement age, so what I'm telling nowadays, because of less jobs, retirement age are getting increased. If you see earlier it was 58, now it's more 62, 65. So for us, maintaining good musculoskeletal system is very crucial, and especially for aged worker, more than 55, more than 50. For males, more than 50. For female, more than 45. Because after menopause, what happened? Estrogen hormone gets decreased a lot in female, so this will cause osteoporotic problem, and this is more common. This is more common after 45. So, and in men, like if you see, if they do heavy work in factories, engineering factories, if they do heavy work, so easily they get low back ache, muscle spasm. So they'll do work less, and physical, social, mental aspects are adversely affected by the musculoskeletal. So impact of impaired musculoskeletal health is now recognized globally with an increase in morbidity and mortality risk factor associated with majority of people associated with various occupations and work-related activity develop various musculoskeletal issues like carpal tunnel syndrome, cubital tunnel syndrome, perhaps intervertebral disc. And I'm not talking about the acute injury. There may be acute injury like fracture of bones, but this is what we are talking about. We are talking about chronic conditions now, which lead to physical disability and social disengagement of worker, lead to extra financial burdens on the society. So, by cumulative efforts of the doctors and educated people of this occupational area, we can decrease this social burden. I conclude with, my talk with a message with that if we go for regular checkup of workers, this is actually employees, not only employees responsibility. This is employer responsibility also. If we go for a regular checkup of health, musculoskeletal health of people, of workers and other other staff also, so we can decrease this we can decrease this social burden and early retirement and day to day musculoskeletal disorder of these employees. Thank you.